When do you stop doing pelvic exams, though?
Good question.
Because that's not the same as a pap smear.
Correct. So
Right.
a pap smear truly is a collection of cells from the surface of the cervix, and that is a screening for cervical cancer. A pelvic exam is where I insert 1 or 2 fingers inside the vagina and then feel the uterus. The purpose of that is to make sure the uterus is not enlarged, to make sure it doesn't feel fixed, and also feel out on either side to make
Can
sure
you
that
feel
the
masses, like
You
fibroids?
can.
And
You can feel if the uterus is enlarged. You may be able to feel cyst. You may be able to tell something's not normal. I may not be able to tell you exactly what's going on. Sometimes when I do that exam, patients have pain and they're like, ow, that hurts. A lot of times if the pelvic exam is not normal, then we do an ultrasound to get more information. Medicare will pay for a patient to come to see me every other year. And that is something that, unless there's something specific in their...
Is that for a well person exam, or what if they have a problem? Will they?
That's different.
Okay.
If you have a problem, you should call us. But
Right.
if you are in otherwise good health and are not having any female-related issues, it is very reasonable to come every other year. And that's to have a breast exam and a pelvic exam. It is one where I still have some patients who do want to have pap smears. Again, we're never going to refuse, but at the same time, it's a conversation to figure out why they so passionately want to have a pap smear, to help maybe answer some questions about anxiety or fear, or maybe they have a friend who had cervical cancer late in life.
Or a sister or a mother.
Exactly.
Right.
Exactly. Cervical cancer tends not to be hereditary. Uterine cancer also tends not to be hereditary. Ovarian cancer is a different conversation, and uterine cancer can be, but typically is not. But cervical is not hereditary, so that's an important point for people to know.